According to the World Health Organization, diabetes is one of the leading causes of death in the world. About 422 million people worldwide have diabetes, the majority living in low and middle-income countries, and 1.6 million deaths are directly attributed to diabetes each year. Both the number of cases and the prevalence of diabetes have been steadily increasing over the past few decades. In 1980, the number of people with diabetes rose from 108 million to 422 million in 2014. Diabetes is a major cause of blindness, kidney failure, heart attacks, stroke, and lower limb amputation. World Health Organization estimates that diabetes was the 7th leading cause of death in 2016. So what is this diabetes that can kill so many people? What are the early signs and symptoms? For someone to know that he or she already has diabetes, be sure to watch the video until the end. There is a free ebook waiting for you, so keep watching. Before we move on to our main topic, if you like this kind of video about health, just click the subscribe button and don't forget to smash the notification bell for more upcoming health tips. Diabetes is a chronic disease that occurs either when the pancreas does not produce enough insulin or when the body cannot effectively use the insulin it produces. Insulin is a hormone that regulates blood sugar. Hyperglycemia, or raised blood sugar, is a common effect of uncontrolled diabetes and over time leads to serious damage to many of the body's systems, especially the nerves and blood vessels. There are 3 main types of diabetes: Type 1, Type 2, and gestational diabetes. Type 1 diabetes can develop at any age, but occurs most frequently in children and adolescents. When you have type 1 diabetes, your body produces very little or no insulin, which means that you need daily insulin injections to maintain blood glucose levels under control. Type 2 diabetes is more common in adults and accounts for around 90% of all diabetes cases. When you have type 2 diabetes, your body does not make good use of the insulin that it produces. Type 2 diabetes is a chronic condition that affects the way your body metabolizes sugar, glucose, an important source of fuel for your body. Type 2 diabetes used to be known as adult-onset diabetes, but today more children are being diagnosed with the disorder, probably due to the rise in childhood obesity. Gestational diabetes. Is diabetes diagnosed for the first time during pregnancy? Like other types of diabetes, gestational diabetes affects how your cells use sugar, glucose. Gestational diabetes causes high blood sugar that can affect your pregnancy and your baby's health. Women with gestational diabetes are at subsequent high risk of type 2 diabetes, especially 3 to 6 years after delivery. Exposure to hyperglycemia in the womb predisposes children to a high risk of becoming overweight or obese, associated with the development of type 2 diabetes. The prevalence of high blood glucose, hyperglycemia, in pregnancy increases rapidly with age, and is highest in women over the age of 45. In 2019, there were an estimated 223 million women, 20 to 79 years, living with diabetes. This number is projected to increase to 343 million by 2045. 20 million or 16% of live births had some form of hyperglycemia in pregnancy. An estimated 84% were due to gestational diabetes. 1 in 6 births was affected by gestational diabetes. What are the early signs and symptoms? For someone to know that he or she already has diabetes. For type 1 diabetes, constant hunger, sudden weight loss, frequent urination, abnormal thirst and dry mouth, lack of energy, tiredness, blurred vision, bedwetting. All people with type 1 diabetes need to take insulin to control their blood glucose levels. There are different types of insulin. depending on how quickly they work when they peak and how long they last. Insulin is commonly delivered with a syringe, insulin pen, or insulin pump. For type 2 diabetes: slow healing wounds, blurred vision, excessive thirst and dry mouth, frequent urination, recurrent infections in the skin, tingling or numbness in hands and feet, lack of energy, tiredness. These symptoms can be mild or absent, and so people with type 2 diabetes may live several years with the condition before being diagnosed. The cornerstone of managing type 2 diabetes is a healthy lifestyle, which includes a healthy diet, regular physical activity, not smoking, and maintaining healthy body weight. Over time, a healthy lifestyle may not be enough to keep blood glucose levels under control, and people with type 2 diabetes may need to take oral medication. If treatment with a single medication is not sufficient, combination therapy options may be prescribed. For gestational diabetes: gestational diabetes does not usually cause any symptoms. Most cases are only discovered when your blood sugar levels are tested during screening for gestational diabetes. Some women may develop symptoms if their blood sugar levels get too high, hyperglycemia, such as needing to pee more often than usual, increased of thirst, dry mouth, tiredness. Having gestational diabetes also means you're at an increased risk of developing type 2 diabetes in the future. How gestational diabetes can affect your pregnancy. 1. Your baby developing low blood sugar or yellowing of the skin and eyes after he or she is born, which may require treatment in hospital. 2. Too much amniotic fluid, the fluid that surrounds the baby in the womb, which can cause premature labor or problems at delivery. And it's called polyhydramnios. 3. Preeclampsia is a pregnancy complication characterized by high blood pressure and signs of damage to another organ system, most often the liver and kidneys. Preeclampsia usually begins after 20 weeks of pregnancy in women whose blood pressure had been normal. Left untreated, preeclampsia can lead to serious, even fatal complications for both you and your baby. If you have preeclampsia, the most effective treatment is the delivery of your baby. Even after delivering the baby, it can still take a while for you to get better. If you're diagnosed with preeclampsia too early in your pregnancy to deliver your baby, you and your doctor face a challenging task. Your baby needs more time to mature, but you need to avoid putting yourself or your baby at risk of serious complications. Researchers continue to study ways to prevent preeclampsia, but so far, no clear strategies have emerged. Eating less salt, changing your activities, restricting calories, or consuming garlic or fish oil doesn't reduce your risk. Increasing your intake of vitamins C and E hasn't been shown to have a benefit. 4. Your baby growing larger than usual. This may lead to difficulties during the delivery and increases the likelihood of needing induced labor or a cesarean section. That's why diabetes are so dangerous. The question is, how to prevent diabetes? Diabetes is preventable. Apply these 4 basic steps to prevent diabetes. 1. No smoking. 2. Proper and balanced diet. 3. Avoid binge drinking of alcohol. 4. Exercise. A minimum of 150 minutes a week. Tomorrow's video. So make sure you subscribe to our channel and click the bell icon so you don't miss this video. Please like and share this video with your families and to your friends. And if you like this video, and if you think it gives you value, please support our channel by subscribing to our channel, and don't forget to turn on the notification bell for more upcoming health tips. Thanks for watching until the end. Check out your free ebook below in the description. Until next time, God bless.